So I've been a speech pathologist since 1993, and one of the things I learned straight away was the speech pathologist is only a small part of the team. And actually there are so many other people out there who are helping children and teenagers and even adults with speech clarity or articulation. And I realised that it was going to be so helpful if everybody who's involved in the whole process could learn more information. I liken it a little bit to people learning first aid. So some of you might have done a first aid course. It doesn't mean you're a doctor. It doesn't mean you've had to do a whole university degree, but you have some knowledge and some skills. And in an emergency, if you're the only one there, you're going to have a go and do things. And you probably agree with me in a lot of ways. Parents are like that. As parents, some of you will be parents. Do you feel like you wear lots of hats? You've probably got the first aid hat and the teacher hat and the driver hat. And of course, parents have to teach their children how to talk. And sometimes that whole process goes really well, and other times there's a hiccup. Now, it could be because the child's been born with a known disability or something obvious, or it could be we don't really know why, and the parent finds themselves with a child that says tar instead of car, or wabbit instead of rabbit. And then most parents have a go. They put on the kind of speech pathologist hat and they have a go and try to help their child. And in many cases, it works really well. But of course, some children do end up coming to speech pathology. And that's why I designed this course, because I want kind of like a first aid for speech pathology. So this could be if you're a parent, if you're a teacher, a teacher's aide or assistant, could be if you're a disability worker, a babysitter, a grandparent. Maybe there are some things that you could learn so that if you are with a child that's saying tar for car, you can have a go and help with their speech clarity. This can work really well if you're in a role where you want to refer a child for speech pathology, but maybe there's a long waiting list. Maybe the parent is not in a situation to access the speech pathology. Maybe the child has had speech pathology and then they're on a break and you're looking for things to do in the meantime. Or if you're a parent or grandparent or carer, maybe you can't afford speech pathology, or you're not sure if you can afford it and you'd like to try some things first. Or maybe you have rung up and made an appointment and there's a long wait. It could also be if you are getting speech therapy, maybe you go once a week or once a fortnight, but you'd just like to be able to do some things in between. And you're perhaps getting a program from a speech pathologist, and you'd just like to boost your confidence of how you can implement that program. So that's what my short course is about. It's about giving people that already have a little bit of knowledge and people that have a lot of knowledge. It's about giving people more skills and tips and tricks so that you can make a difference in your role. I've designed it to be over 12 sessions or 12 topics because you can't learn all of this really quickly. I believe that actually, if we just did it for 3 hours, well, you'd just skim the surface, wouldn't you? Because speech pathologists actually spend several years at university learning this stuff. Our degree is generally 4 years or 2 years as a master's, but we spend lots and lots of time learning about speech, sounds and articulation. So I wanted this to be a thorough course. What I'm going to do in a minute is we'll have a look at the topics so you can hear that this course does go in depth. And it does include some theory and some background knowledge. And then it includes some practical activities. And it includes opportunities for you to think and learn and get feedback on your learning and interact and ask questions.